Welcome to Medical News Update, health research translated into plain English. Today's story: a huge study from Germany suggests we may be able to spot type 1 diabetes in children years before they ever have symptoms. And the screening can happen right in a regular pediatrician's office. First, a quick reminder. Type 1 diabetes is different from type 2. In type 1, the body's immune system attacks the part of the pancreas that makes insulin. Once enough cells are destroyed, the child can no longer regulate blood sugar without insulin injections. Type 1 usually appears in childhood. For many families, the first sign is a medical emergency, a dangerous condition called diabetic ketoacidosis, or DKA, where blood sugar climbs to a crisis level. But here's something many people don't realize. Type 1 diabetes doesn't start the day symptoms appear. The immune attack begins quietly, sometimes years earlier. And there is a blood test that can detect it. The test looks for antibodies in the blood markers that the immune system has started turning against the pancreas. A German study published in the journal JAMA, that's the Journal of the American Medical Association, tested whether this kind of early screening could be done not in a research center, but in ordinary pediatric clinics. The program, called FRIDA, ran in Bavaria, Germany, from 2015 to 2025. Over those 10 years, 716 primary care pediatricians screened more than 220,000 children. That's a huge number, well over 200,000 kids. At the first screening, 590 children were found to have early-stage type 1 diabetes. Early stage means the antibodies were present and the immune process had already started, but the child wasn't yet sick. Blood sugar was still normal, or only slightly elevated. They didn't yet need insulin. Then researchers followed those children over time, and what they found is striking. About 81% of the children who went on to develop full type 1 diabetes during the follow-up period were already flagged by the screening years earlier. The yearly progression rate from early stage to full clinical type 1 was 9.6%. Why does this matter for families? First, most children diagnosed with type 1 diabetes have no family history. Parents often had no warning. A screening program like FRIDA catches the condition before the crisis. Second, early detection gives families time to learn the warning signs of high blood sugar, time to connect with a specialist team, time to plan, instead of being rushed to an emergency room with a child in DKA. Third, early detection may also open doors to newer treatments. There are now drugs being tested and one already approved that may delay the start of type 1 diabetes once early antibodies are found. A few important caveats. This study does not mean every country should rush to screen every child tomorrow. The German program was carefully structured, with confirmation testing, follow-up appointments, and specialist support built in. A single screening test, without that follow-up infrastructure, would not give the same benefit. It also does not mean parents should arrange testing on their own, through online services or unregulated labs. Talk to a pediatrician or diabetes specialist first. And finally, a positive antibody test is not the same as a diagnosis. It's a marker that the body is on a path. Not every child progresses to full diabetes, and even those who do may take years. The big picture is hopeful. Type 1 diabetes has been notoriously hard to predict. This study and the program behind it shows we can do much better. That's today's medical news update. Share this with any family with a young child, especially if diabetes runs in the family. Until next time, stay curious, stay healthy.